In 1954, there was a large measles outbreak at a boarding school outside Boston, Massachusetts. Throat swabs and blood samples were taken from the students and cultured to see if the measles virus could be grown. Dr. Thomas Peebles was able to grow some of the virus from a throat swab from an 11-year-old boy named Thomas Edmondson. Peebles' boss, Dr. John Franklin Enders, was able to use that culture, specifically the Edmondson B strain, to develop a vaccine. This virus was grown and forced to go through many generations. The scientists were trying to get a mutated strain that could live, grow, reproduce, but couldn't cause the disease. This is called attenuation. This strain of the virus is the basis of what is used to produce the measles vaccine today. From 1958 to 1960, Enders and his team tested this new vaccine on small groups of children. Once these studies showed that the vaccine was safe, large clinical trials on thousands of children in New York City and Nigeria began. In 1961, it was hailed as 100% effective. The first measles vaccine was licensed for public use in 1963. From then on, countries introduced mass vaccination campaigns at a national level. The first internationally focused measles vaccination programs started in Africa in 1966. Despite the challenges of it being a live virus vaccine, meaning it had to be kept cold in transit, Gambia became the first country in the world where transmission was interrupted in May of 1967. In 2016, the Pan American Health Organization, the regional office of the WHO, declared the region of the Americas to be measles-free, or free of endemic measles. In 1968, a new version of the vaccine was created by having the virus go through 40 generations inside chicken embryo cells inside eggs. This weakened the virus further and led to a vaccine that didn't cause severe side effects that the first edition did. In 1971, the measles vaccine, mumps vaccine, and rubella vaccine were combined into one shot, the MMR. And in 2005, the varicella or chickenpox vaccine was added, making the MMR vaccine that is commonly used today. It is estimated that between 2000 and 2023 alone, the measles vaccine has prevented more than 60 million deaths worldwide. Hello everyone and welcome. My name is Dr. Jeremy. I am the Everyday Epidemiologist. Today, we will be continuing to talk about measles, focusing on the vaccine. But before we get into that, a few quick disclaimers. First, I'm not a medical doctor. Nothing in this video is medical advice. Any medical advice you want or need should be obtained from your physician. Second, this information is being brought to you by me alone as someone who knows a bit about public health. It is not coming in any sort of official capacity from the health department where I work. Third, all of this information provided in the video comes from publicly accessible websites, books, and research articles. The sources will be in the description of the video as well as in the first pinned comment. Fourth, I try to provide as accurate and scientifically based information as possible. However, I may misspeak or say something that is incorrect. If you catch me on this, please leave a comment with what I said wrong, and if possible, a source to the correct information, and I'll look into it. If I was wrong, I will provide the correct information in a future video. I will stop periodically throughout the stream, for questions. However, feel free to type any questions you have in the chat at any point, and I'll answer them as I see them. If you're watching later on the VOD, please leave your questions in the comments and I'll answer them as soon as possible. Sorry about that. This episode will be broken into 3 sections. In the first section, I'll talk about the effectiveness of the vaccine. How protected are you if you get the shots? Second, I'll talk about the safety of the vaccine, any potential adverse reactions, and the autism issue. This one is going to be long and packed with information, so I'm sorry. Finally, I will get into why the vaccine is necessary. I'll talk about herd immunity, the anti-vax movement, and how that movement has led us to the situation we are in today with several very large outbreaks in countries that should have no measles. So, with that out of the way, let's get into the shortest of the sections about efficacy. Last episode, I mentioned that the best way to prevent catching measles was to get the vaccine. I also mentioned that the vaccine is safe, which I will cover shortly, and it is effective. What do I mean by the vaccine is effective? I do not mean that 100% of the people that get the vaccine will not catch measles. No vaccine is perfect. There will always be breakthrough cases or people who get the disease even after getting the vaccine. But there are some vaccines that are pretty dang close. A vaccine's effectiveness is the percent of people that are protected in real-world situations, where things like age, previous conditions, interactions with other drugs, and more can influence the vaccine and how it works. That being said, the MMR vaccine is very effective against measles, mumps, and rubella. Depending on where you look, 2 doses of the vaccine properly spaced is between 97 and 99% effective at preventing measles, 86 to 95% effective at preventing mumps, and 90 to 97% effective against rubella. That means that 97 to 99% of people that get both doses of the vaccine will not get measles. These are incredibly high numbers. By comparison, the seasonal flu vaccine effectiveness has ranged between 19% and 60% depending on the year, dating back to the 2009-2010 flu season. So yes, the measles vaccine is effective at preventing people from getting measles. Now, I don't want you to look at the flu vaccine effectiveness and think, what's the point of getting the vaccine if there's only a 20% chance it'll protect me? You should still get the vaccine. 20% protection is better than 0% protection. And even if you do still get the flu, it will likely be a more mild disease than if you don't get the vaccine. So please, still vaccinate, vaccinate, vaccinate. So that's effectiveness. Basically, the measles vaccine is incredibly effective. And if you get it, the chances of you getting measles is very, very low. So as I said, fairly short section, but before we get into the longest of the sections about safety, I'll take a quick break and see if there are any questions about measles from the last episode, or anything about the effectiveness so far at this point. And also, hello everyone in chat. Nice to see you all. Thanks for stopping by. Unofficial Matt raid. Hey everyone, welcome, welcome. I hope you all had a good time doing Matt's thing this morning. I hope there were lots of good deaths over there in Valheim. Sorry I wasn't able to join you. Hopefully next week. Sarah died a lot. Good, good. Glad to hear that. Deaths in Valheim are a good thing. Deaths from measles, not so much, but deaths in Valheim are fun. How does the effectiveness of measles compare to polio vaccine? That's a good question. I don't know the effectiveness of the polio vaccine. I think the polio vaccine is also very, very effective, but let's look that up. Let's see. All right. Yeah, very effective. So 2 doses of the polio vaccine is 90% effective, while 3 doses are between 99 and 100% effective. So polio vaccine is also very, 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 very effective. Also one of the more effective vaccines out there. But fairly comparable. The polio vaccine full complement might be a little bit more effective, but I mean, when you're looking at the difference between 97% and 99%, that's fairly minimal. But yeah, very, very effective. Very effective. All right, so since that was a fairly short section, there probably aren't too many more questions. Sounds like both do a great job. Yes, absolutely. Both do a great job and both are very important and very necessary. But let's go ahead and move on to the next section. All right, let's talk about how safe the measles vaccine is. It is safe. There you go. Done. Section over. What? You want more info? Fine, fine. Let's get into it. What do I mean by safe? Do I mean that there are no adverse, undesirable, or bad side effects of the vaccine? No. What I do mean is there are not many adverse effects, and most of them are relatively mild. While severe side effects do occur, they are quite rare. But let's go over these adverse effects. Common side effects of the MMR vaccine include fever, typically less than 102.2 Fahrenheit or 39 Celsius, headache, pain, redness at the injection site, irritability, loss of appetite, drowsiness, swollen lymph nodes, and a rash. All of which typically resolve after a day or two. So relatively mild, relatively minor. Now there is a list of noted but very rare side effects that are more severe. These include vesiculitis, nausea, vomiting, diarrhea, otitis media, conjunctivitis, thrombocytopenia, anaphylaxis, Guillain-Barré syndrome, seizures, encephalitis, ataxia, pneumonia, pharyngitis, and others. Now, I know that list of symptoms and events sounds scary. I get it. It does. It really does. However, as I said, these are quite rare, and some may potentially not even be due to the vaccine itself. The way vaccine adverse event reporting works is whenever something happens shortly after receiving a vaccine, it gets reported. It could just be a coincidence that it happened at the same time, and it's not actually due to the vaccine, but it still gets reported just in case. Even the ones that are more likely due to the vaccine itself, they often occur much less frequently than they do when you have measles, the disease. Encephalitis, for example, occurs in 1 out of every 1,000 measles cases. But with the vaccine, it occurs in 1 out of 1 million doses, or approximately 1 out of every 500,000 people vaccinated. So, obviously, it's still much better. A study by Pacha et al. In 2001 published a result of a 14-year study from 1982 to 1996. They looked at 1.8 million with an M, individuals vaccinated with the MMR vaccine to see what adverse effects there were. In total, they found 173 potentially serious reactions, including 1 death. However, 45% of these were shown to be probably caused by other factors and not by the vaccine. Even with the probable adverse events of the vaccine, it is still much better to receive the vaccine than to not and to get the disease. Now, I want to address the big elephant in the room. The idea that vaccines, particularly the MMR vaccine, cause autism. I'll start this section by saying something that I will repeat over and over and over. Vaccines do not cause autism. They don't. At all. With that said, for the first time, let's get into how this idea started and the science debunking it. The MMR vaccine was approved for use in 1971 after each of the individual vaccines had been approved during the 1960s. This vaccine had been used safely and effectively for the next couple of decades. However, in 1998, Andrew Wakefield and his colleagues published a paper in the journal The Lancet, where he proposed that the MMR vaccine caused a series of events that led to autism. These events included the vaccine, which caused intestinal inflammation, which caused proteins that are harmful to the brain to enter the bloodstream, and then that led to autism. This study described 12 children who had developmental delay. All of them had intestinal complaints, and 8 of them were diagnosed with autism within 1 month of receiving the MMR vaccine. However, this study and the link Wakefield described was very flawed. At the time, 90% of the children in England, where the study occurred, were receiving the MMR vaccine. Also at that time, more and more children were being diagnosed with autism for reasons including increased awareness and testing, and changes that were being made to the definition of autism. So, yeah, you would expect some children diagnosed with autism to have recently received the MMR vaccine. Additionally, most children aren't diagnosed with autism immediately after parents notice the symptoms. It can take months or years. So the fact that all 8 were diagnosed within 1 month after the vaccine makes that link more questionable. But no information about when autism symptoms or concerns started was mentioned in the paper. A case study like this, especially one with so few people, is not appropriate for discovering a correlation, much less a causative link. For that, you would need a large study looking at the incidence of autism in children that are vaccinated versus children that are not. Additionally, all 8 of the children with autism in this study showed the intestinal inflammation after the diagnosis of autism, even though Wakefield claimed that that was part of the causative pathway. So I'm not sure how something that happened after an event caused that event, but yeah. This paper was soon retracted by the journal because it was found to be based on scientific misconduct. Let's see. Susan says, I would even wonder if the brain changes could happen in such a short time after the mentioned increased autism. Yeah, exactly. I mean, I would question that as well. But when you're trying to fit data to your hypothesis, which it appears that he was doing, you can just make stuff up, which is why the paper got retracted. As you can see in the picture. There it is. There's the picture. Unfortunately, Wakefield didn't stop there. In 2002, he tried again and published a second paper looking at the relationship between the measles virus and autism. At the time, this time, they took intestinal biopsies from 91 children with autism and 70 without. In 75 out of the 91 children with autism, the measles virus was found in the biopsy. The virus was only found in 5 of the 70 children without. This looks pretty damning for sure. However, this study was also critically flawed in many ways. First, The measles vaccine is a live virus vaccine, and the virus reproduces between 15 and 20 times after the shot is given. During this time, the virus is taken up by the immune cells, which is what they're supposed to do so that they can learn about the virus and develop defenses. This is how vaccines work. These immune cells are highly mobile and can and do move to all areas of the body. So the fact that the virus was found in the intestines is not abnormal. To account for this, children in the study must be matched, meaning all potential associated variables must be the same other than the one being investigated. In this study, that's autism. So children with autism must be matched with children without autism based on vaccination status, length of time between MMR vaccination and the biopsy, and other variables. The problem is, we don't know if this was done. This information was left out of the paper. It would have been available to the investigators, but we don't know. A second area where this study was flawed is it did not distinguish between the vaccine measles virus and the wild measles virus. This difference could have been determined, but it wasn't. Third, the method used to detect the measles virus was very, very sensitive and created a high risk of false positive results, meaning they detected the virus when it wasn't really there. The paper made no mention of this or how they avoided that problem. Lastly, in all studies like this, information about the subjects should be hidden from the investigators during testing. They should not know if a sample came from someone with autism or someone without. This is called blinding. This is done to prevent investigators from adding their own biases. There was no mention in the paper whether this blinding occurred or not. And that's it. Those are the only two studies that have shown a link between vaccines and autism. Two very flawed studies with questionable or outright fraudulent results. That's what started it all. Now, before we move on to the science rebutting this claim, I do want to address something. Science can't prove a negative. You can't prove something never happens or can't exist. This is an argument used by RFK Jr., the Make America Healthy Again people, the anti-vaxxers, and anti-science people in general. In this, they are right. However, the way they interpret that fact is wrong. I'll give you an example to show why this line of thinking to shut down science is stupid. Say I ask you to prove that no ravens are red, and no ravens can be red. How would you go about doing this? Well, you could start by looking in your area to see what color the ravens are. You don't see any that are red, and you come to me and say, see, no ravens here are red, so ravens can't be red. I'll come back with, well, what about ravens in other parts of the world? So you spend months, years maybe, looking all over the world and you don't see any red ravens. You would say, look, no red ravens. Ravens can't be red. I'll come back with, well, what about before you started looking? Or what about 10 years from now, 50 years from now, 100 years from now? What if there was a red raven then? No matter what you do, no matter how much research you do, you can't prove a negative. But what you can do is get a massive amount of data and say, look at all this data from all over the world for years. It indicates that ravens are not red, so we would suggest that ravens cannot be red. With massive amounts of data from many studies, you can be very certain of a negative or of no causation or correlation, but you cannot be 100% certain. Susan asks, how much more has this potential for autism been researched over the last 10 years? We're about to get into that. So now let's look at the science that counters these studies and indicates that there is no link between vaccines and autism. In my research for this episode, I found 24 studies, but there are likely many, many more that were performed in 7 countries and across 3 continents, and they have all found the same thing. There's no increased risk for developing autism after receiving the vaccines. 21 of these studies were specific to the MMR vaccine. One of the main tenets of science is repeatability. Before we get into that, Matt says, definitely difficult when you're using facts and logic against ego. Yeah, that is difficult. That's difficult. As a side tangent, there was a study I read about several years ago. I think the study actually happened in the 70s or 80s, but I don't remember all of the facts of the study, but basically what they found is facts don't change minds. Even if you tell someone a fact, it won't change their previously set opinions. So it's very, very difficult to change minds. Absolutely. But yeah, we're talking about repeatability. So one of the main tenets of science is repeatability. If your findings can be repeated by other people in other settings, there's a good indication that it is true. If nobody can repeat what you did, it is more likely that your findings and/or study are suspect. Another great way to suggest that the findings from studies are true is if similar conclusions are made from different types of research studies. Some types of research studies include case control studies, cohort studies, cross-sectional studies, ecological studies, and systematic reviews and meta-analyses. Some of these have stronger evidence than others, but all of them are legit types of studies. But we will cover what these studies are and talk about the different types of, when we talk about the different studies that show no link between vaccines and autism. Crumbs, you can sometimes change minds by claiming something even more outrageous. That is true. Yeah, absolutely. Outrageous claims do affect people because, I don't know. I guess the way the human mind works is they like extreme, outrageous things for some reason. I mean, I do too, but yeah, and you can change some minds, but it is very difficult. It is very difficult to change minds. Mayor says, screw studies, because I read online articles. Surely they don't lie. Yeah, exactly. No one ever lies on the internet. And it's not like half of the crap on internet these days is AI either. So yeah, and AI never lies either. So yeah, exactly, Mayor. So let's start with case control studies. A case control study takes 2 groups of people that are as similar as possible, except for the fact that if they have the condition you are studying. This condition could be a disease, a lifestyle choice, an environmental exposure, or a medical intervention like a vaccine. You then look to see what impact that condition has. I found 6 case control studies that look at the MMR vaccine. One by Yoto Uno et al. In 2015 looked at vaccination histories of 189 people with autism spectrum disorder, or ASD, and 224 without. There was no significant difference in vaccination rates between the 2 groups. A study by Dorota Mrozek-Budson, I'm sorry if I mispronounced that, I probably did, and all in 2010 included 96 ASD cases and 192 controls without. They actually found that the autism risk was lower in children vaccinated with the MMR vaccine compared to those who were not. In 2008, G. Baird et al. saw no difference in the antibody response to the MMR vaccine between 98 children with ASD, 50 children with special needs but no ASD, and 90 children without either of these conditions. This indicates that the measles vaccine response does not lead to autism. Another study in 2026 by Yasmin D'Souza et al. Looked at a different marker of immune response to the vaccine in 54 children with ASD and 34 without, and found no difference. A 2004 study by Liam Smith et al. Included 1,294 cases with ASD and 4,469 controls. 78% of the cases had the MMR vaccine before diagnosis, and 82% of the controls had the vaccine before they were the same age. Basically no difference, and no statistical difference. Finally, in 2004, Frank DeStefano et al. Compared 524 children with ASD and 1,824 without. There was no difference in MMR vaccination status or the age at which they were diagnosed. Splash of pain. Google told me that brain rot actually rots your brain, and that seems to be true, so I believe everything on the internet. Well, I mean, some things on the internet are true, like this video here in particular. This is true. This stuff I'm saying here is true. So some stuff on the internet is true. And Matt, woo, cognitive biases. Yeah, they're fun. They're fun to learn about and fun to study. Less fun when they cause problems in the world. Oops. Up next, let's take a look at some of the 8 cohort studies. A cohort study is one that follows a population of people over time to see how different factors affect their health. In this case, they would take a group of children and follow them for years. At the end, they would look at 4 groups: the children with MMR vaccination and ASD, children with no vaccination and ASD, children with no vaccination and ASD, and those with no vaccination and no ASD. I think I said that right, but look at the picture. Look at the picture. The picture's right. Oh, there we go. Let's point at the picture. That way. Those are the 4 groups. Even if I didn't say it correctly, it's hard. After they look at these 4 groups, analysis would be performed to see if the vaccination rates for ASD were increased in any of the groups or not. Crumbs. Hey, if it wasn't for the internet, I would never have learned about the nanobots in the drinking water. that too. As Sarah, words are hard. Absolutely. Especially when you're talking about 4 groups that are very similar like that. Words are hard. So let's talk about these 8 some of these 8 studies. A 2002 study by Matson et al. Followed 537,303 children for an average of 4 years. 82% had received the MMR vaccine. There were 738 later diagnosed with ASD. They found no increased risk for ASD for those who were vaccinated. Michaela et al. Also in 2002 followed 535,544 children vaccinated with the MMR for 4 years. There were only 352 that were diagnosed with ASD. None of these children diagnosed with ASD had inflammatory bowel disorders, which goes back to Andrew Wakefield's crappy hypothesis. E. Frumbone et al. In 2006 looked at 27,749 children over 13 years, looking for various developmental disorders. They found that developmental disorder rates increased as vaccination rates decreased over time. In 1996, when the second MMR dose became recommended in Canada, there was no increased risk for developmental disorders seen. In 2019, HIVID published a study following 657,461 children in Denmark for almost 14 years. Of these, 6,517 were diagnosed with autism spectrum disorder. When comparing those who were vaccinated with MMR and those who were not, there was no difference in the proportion of ASD diagnosed children. Now, to save time, we will skip the 3 ecological studies. But this is a type of study where population-level data is collected to help identify broad patterns and factors that affect the health of a population. None of these 3 studies showed any correlation between the prevalence of MMR vaccination and the incidence of ASD. Systematic review and meta-analyses papers summarize and combine the data from previously published studies. This is done to help identify broader patterns in the data and to have a more reliable results due to having larger populations included in the studies. There have been at least 4 of these studies published from 2003 to 2021. They include hundreds of studies and millions of participants. When I say millions, I literally mean millions. One review from 2021 by, I'm going to mispronounce this word, Pitrandonj et al. And analyzed 138 studies, which had a total of over 23 million participants. In all of these studies, the conclusions are clear. There is no link between the MMR vaccine and autism. There are other studies looking at other vaccines to see if they may be linked to autism. They look at the influenza vaccine and the tetanus, diphtheria, acellular pertussis vaccine, also known as Tdap. I won't cover those studies here other than to say they aren't associated with autism. They don't cause autism. Just a couple of weeks ago, the World Health Organization Global Advisory Committee on Vaccine Safety met to discuss all the available evidence on vaccines and autism. This committee, formed in 1999, brings together international experts on to provide independent, authoritative, scientific advice to the WHO on global vaccine safety-related priorities. They found no causal link between vaccines and autism spectrum disorder. This evidence was based in part on 31 studies investigating thimerosal containing vaccines published from January 2010 to August of 2025 and included data from multiple countries and found no connection. Thimerosal is the mercury-containing compound that took some heat in the late 90s, but has never been shown to be associated with increased risk for autism. They also reviewed studies from 1999 to 2023 investigating aluminum adjuvants in vaccines. And guess what? There was no associated risk between trace amounts of aluminum that is present in some vaccines and ASD. So while science can't conclusively 100% say vaccines don't cause autism, the research is pretty dang clear. So I'll say it. Vaccines don't cause autism. And now I'll take a break for some questions while you digest this information. And I see that there are a couple of questions already. Questions for when you discuss it. What are the studies that Kennedy is initiating? Is there any transparency in this new research? That is a good question. I don't know, because as far as I know, there's no information about those studies out because I don't know. I don't know anything about those studies. I can't find anything about those studies. I don't know if there will actually even be any studies. And even if there are, they won't be We won't know a ton until they're published, but they're likely going to be crappy studies, and or they're going to show that vaccines don't cause autism because they don't. But yeah, that I am very curious to see what the heck he's trying to do. I have a feeling what he's doing is doing basically what Andrew Wakefield did. He has a hypothesis, and he is going to try to make the science. He's going to try to make the data fit that hypothesis, which is not good science. That is the opposite of good science. So it'll be interesting to see what he comes up with, but I guarantee it's going to be crap. When did I say that that international meeting was? So they met. I don't know exactly when they met, but it was sometime in November. Their findings were released in the last week of November or the first week of December. So within the past month, they've met. Mayor, interesting question you hear people ask. Can you vaccinate people with autism? Yes, absolutely. Now for certain vaccines, for most vaccines, there are contradictions or counter. I can't think of the word. There are contraindications. That's it, contraindications. There are things that you should look for that are reasons why you should not get a vaccine. A lot of those are due to like allergies, interactions with other medication, and for some vaccines, decreased immune immune system in the person. But for the most part, people with autism don't have any higher rate of those than the general population, as far as I know. But yes, people with autism can get vaccines. Absolutely. So yes, even if you have autism, get the vaccines. Get the vaccines. Vaccines will save your lives. Now, I would suggest talking to your physician before you get any vaccine, especially if you have any prior conditions or any concerns, because they know a lot more than I do especially about certain specific vaccines and about your medical conditions and things like that. So talk to your physician, but yeah, get the vaccines. Get the vaccines. So, are there any other questions about the safety of the MMR vaccine or about the vaccine autism crap? Before we move on, anything else you have questions about at this point? Will I ever touch on the potential causes of autism? Likely. I will likely do an episode on that. I'll say that the problem is a lot of the answer to that is we don't really know. There are a lot of factors that go into it, some genetic factors, some environmental factors, but what exactly those genetic factors are, what exactly those environmental factors are, exactly how they interact, we don't really know. But I will likely do an episode on autism at some point. I don't know if it likely won't be really soon, but yeah, I'll do an episode on that at some point. I'm sure. All right. Well, don't see any other questions at this point, so let's get into the necessity of the vaccine. Why is it necessary that everyone who can get the vaccine does? This gets into something called herd immunity, also called population immunity. This is the indirect protection. Oh, I actually didn't have the picture I wanted. Let me pause real quick and actually pull up the picture of herd immunity that I wanted. Apparently I didn't save that picture. Let's open an image, new tab. Here we go. Here we go. This is a picture of herd immunity that I had wanted to share. Herd immunity is the indirect protection from an infectious disease when a large portion of the population is immune to that disease, and either through vaccination or through previous infection. In other words, if someone in a community gets a disease, but just about everyone around them is immune, then the disease has a hard time spreading to other people. So here in this picture, you can see where there's no herd immunity, where very few to no people are immune. One person gets a disease, they can infect several of those around them, each of those can infect several other people, and the disease can spread very rapidly. If there's high immunity, shown by the green color people here, I'm sorry for those who are colorblind, this is not a good picture for y'all, I apologize for that. But when there's high immunity, one person who gets the disease can infect just one, maybe two, very few people around them that are not immune, because most of the people around them are immune and cannot get infected. And the disease cannot spread very far. Waddle, like what they basically did with COVID, isn't it? It's what we tried to do with COVID, at least. Yes, exactly. Obviously, we didn't really do a great job of reaching herd immunity, but that was the goal. That was the goal. Absolutely. You are correct. So, let's see. Mayor says, yes, Waddle, the goal of most vaccines is basically the same herd immunity and gradual elimination of the disease. Exactly. Chroma says, we kind of did. The herd is still here. And part of the problem with COVID, and I will do at least one episode on COVID eventually. That's going to be a lot of research, so that will be a while. But I will do some episodes on COVID. But one of the problems with COVID in particular, especially compared to like measles and some other viruses, some other diseases, is it mutated incredibly rapidly. So even if we reached herd immunity or got close to herd immunity, it mutated and was able to get around the immune defenses from the vaccine, which is why you need the annual booster shot, because there's a different strain out there that the vaccine that you have may or may not be effective against. So that's why you need to keep getting that shot. But yes, that is the goal of pretty much all vaccines, to stop each person from getting the disease and stop it from spreading within the population. All right. So, in order to achieve a good herd immunity and thus population protection from measles, and to hopefully eliminate measles, over 95% of people need to be immune. So I'll ask again, why is it important for you to get the vaccine? Well, besides the fact that, as we talked about, it protects you, through herd immunity, it also protects others. There are some people that for medical or religious reasons can't get the vaccine. If everyone who does get it, or everyone who can get it, does, then should the disease rear its nasty head in the community, it will have a very difficult time spreading to the unprotected people. Matt, people with autoimmune issues depend heavily on herd immunity, depending on people around us to actually care about public health. Exactly, yes. People with autoimmune disorders, people with no immunity or decreased immunity, like people with uncontrolled HIV or various other things, cannot get the vaccine, or even if they do, it may not have any impact. So they need the people around them to be vaccinated to help protect them. Kind of like the flu, it mutates so fast we can't get rid of it. That's part of the problem with flu. Another problem with flu, and part of the reason why we need vaccines each summer, is there are, and I will do an episode on flu eventually as well, there are hundreds, maybe thousands of viruses that cause the flu. And the vaccine covers between 3 and 5 of those. The ones that we predict will be most common in a community in that year. So, and the viruses that are going to be common each year change each year. So that's why I need to keep getting it. How worried are you about mutations? Will the basic vaccine still be effective? So for measles, it is still effective. And we'll see that later when we talk about some of the current numbers. But there are a lot of scientists, a lot of vaccine scientists that are doing a lot of research on that. They do continual research on that to make sure that the vaccine is still effective, to look for any mutations that may exist in these diseases. And if there are, change the vaccine to be effective against those. So, I mean, there is a little bit of worry about that, of course, but with the measles vaccine, it still works. It still works very, very well. Waddle, when you were little, your brother and sister had measles. Ooh, I'm sorry to hear that. You did not. You were removed them, but never got it. Might it be that you were a carrier? No. As far as I know, there is no asymptomatic infection of measles. I believe from what I saw when researching the last episode, if you get infected with the disease or with the virus and you're not don't have the vaccine, you will get the symptoms. But it also isn't a disease, isn't a virus that you will carry with you years on. Either you get the disease and your body fights it off, and you recover, or your body fights it off and you don't get it. Those are the two options. I didn't get any of the childhood illnesses ever to this day. Well, a lot of that is likely due to vaccination. Yay, vaccines. They work. They are good. That is a good thing. I've never had mumps, measles, rubella because of vaccines. I did have chickenpox, but that was because it was before the chickenpox vaccine came out. But because of these vaccines, most people don't experience these childhood diseases anymore. And that is a good thing. That is why we want vaccines. Exactly. Yes. That is a great point, Waddle. Absolutely. So, back to herd immunity. In a population where no one is vaccinated, one person with measles can infect between 12 and 18 others. If 66% are vaccinated, one person will infect 5 others. If 82% are vaccinated, like in Gaines County, Texas, which has been hard hit by a measles outbreak in 2025, one person will infect 2 to 3 others. Huh? Looks like the stream is having issues. Let me know if y'all can still hear and see me, or if there are buffering issues. Then we still here? Everything still good with the stream, or we having issues? Seems fine. Okay, good deal. So yeah, since I was kind of distracted, I'll repeat that last sentence. A little bit of buffering happened, but your reloading seems fine. Okay, good deal, good deal. So I'll repeat that last sentence since I was a little distracted. I want to get this point across. If 82% of the population are vaccinated, like in Gaines County, Texas, which has been hard hit by a measles outbreak in 2025, one person will infect 2 to 3 others. This is a similar rate to what COVID-19 will do. If 95% of people are vaccinated, fewer than one person will become infected by someone with measles. And remember from last episode, from the first episode about smallpox, that's where we talked about it. If fewer than one person will become infected by someone with a disease, the outbreak will die out. If more than one will become infected, it will continue and expand. So high levels of vaccination is critical, especially for diseases that are as contagious as measles. Was the anti-vaxxers trying to shut you up? It is YouTube after all. I like it. I like it. That's good. That's good. And now, this brings us to the anti-vax movement. Speaking of which, what is the current vaccination level in the US? We'll get to that shortly. Good question. Why is the anti-vax movement dangerous? Aren't the anti-vaxxers busy trying to find the edges of the flat Earth? Some of them, they don't. Those circles aren't a perfect overlap. There are some differences there. But yeah, good point. Good point. A lot of people that get into one conspiracy theory get sucked into others. So yeah, absolutely. The idea of vaccine hesitancy or anti-vaccination is not a new thing. Even back in the 1850s and 60s, there were those that were against the vaccines. This was less than 100 years after the development of the first vaccine against smallpox. There were anti-vaccine riots in England in the 1950s, Canada in the 1980s, and in the US in I think I said that wrong. England in the 1850s, Canada in the 1880s, and the US in the 1890s. In 1905, there was a legal case that was brought before the US Supreme Court about vaccines. They would rule that vaccine mandates were constitutionally legal. Even as the smallpox vaccine would eradicate smallpox from the face of the earth, the polio vaccine would do all but the same with polio, and the measles vaccine would save the lives of millions of people. Anti-vaccine activism didn't disappear. With the advent and growth of the internet and social media in the late 1900s and early 2000s, these movements intensified. A poll in the UK in 2018 showed that 9 out of 10 adults said that the vaccines were safe and effective. In 2023, a repeat of this poll saw only 7 out of 10 adults saying the same thing. In 2019, the WHO declared vaccine hesitancy one of the world's top 10 threats to public health. Then COVID happened. The vaccine hesitancy and anti-vax movement gained steam as the COVID vaccine was developed and rolled out. In the US and elsewhere, much of this was pushed by political figures and those on the conservative side of the political spectrum. Even now, The head of public health and healthcare in the US, RFK Jr., is a vaccine skeptic. The Advisory Committee on Immunization Practices, or ACIP, is the Vaccine Advisory Committee for the CDC. They are the ones that develop vaccine recommendations and recommendations for the vaccine schedules in the US. This summer, the team of scientists and vaccine and health experts on this committee were fired and replaced with a group of vaccine skeptics and anti-vaxxers. They were handpicked by RFK Jr. to support and promote his and President Trump's opinions on public health and vaccines. Stupidity spreads faster than diseases. Stupidity is one of the worst diseases out there. And I don't mean lack of education. I mean, being, yeah. Anyway, next picture. All of this has led to a decreased vaccine utilization. Multiple areas in the US have measles vaccinations well below the 95% recommended rate. In Minnesota, only 86.5% of children enter kindergarten that are vaccinated with MMR. This is down from 92% before COVID. 78% of the 2,066 counties in the US have seen MMR vaccination rates drop from 2000 to 2025. The average county level vaccination rate in the US fell from 93.92% to 91.26%. So there's your answer, Susan. About 91% of the US is vaccinated with MMR, which is below the 95% recommended level. But even before the pandemic, the US struggled. In 2016, the vaccination rates in 17 countries were compared. The US was 12th. But don't think I'm just picking on the US, or that this is just a US problem. Vaccine hesitancy is a global issue. Approximately 20% of children globally are missing one or both MMR doses. This is higher than at any point in the past 2 decades. Much of this is due to the political polarization of vaccines and the amplification of vaccine misinformation during the COVID-19 pandemic. So where does all this leave us today? What actual impact has this decrease in vaccination caused? Unfortunately, this has caused the number of measles cases, the number of measles outbreaks, and the size of the outbreaks to increase over the past couple of years. Globally, measles cases are spiking. In 2024, there were 11 million measles cases. That is 800,000 more than there were in 2019. There was an 86% increase in cases in the Eastern Mediterranean region, a 47% increase in the European region, and a 42% increase in the Southeast Asian region over this period. In 2024, 59 countries reported large or disruptive measles outbreaks. This was triple the number reported in 2021, and the highest number since the onset of COVID. In 2024, all WHO regions had at least one country experiencing a large outbreak, with the exception of the Americas. I just want to make sure I'm on the right picture. Yeah. But all that changed in 2025, with several large outbreaks occurring in multiple countries in the Americas. Oh, the pictures. All right, what's going on with my pictures? Hold on a second. Let me get back to the picture I was on. Not sure what happened there. I'm sorry. Hit the wrong thing. Nope. Let's keep going a little bit further. We'll get back there. We'll be there soon. Explain the colors on the map. So sorry the picture's a little bit small. Um, Let me pull it up a little bit bigger so I can see a bit better as well. Okay, so basically the darker the color, the more cases there are. So this is presented as a rate. So the number of measles cases per 1 million people in that country. So the lightest colors, like in Egypt, maybe Brazil even. I don't know, it's kind of hard to tell some of them, but those have a rate of fewer than one measles case per 1 million people in the country. The darkest colors show more than 50 cases per 1 million people in the country. And the countries with the highest rate are shown on the side of the map, and they are Mongolia, Kyrgyzstan, Yemen, Laos, Romania, Afghanistan, Tajikistan, Angola, Georgia, and Kazakhstan. Mayor, we used to have 100% because a bunch of vaccines were mandatory, but then people somehow found a way out of it and it dropped to like 95% the last years. Yep. People are trying to find any way that they can around vaccines for some reason. What's up with Canada? You tend to think that they're relatively smart. Well, there are a lot of anti-vax people up in Canada as well. And we will get into the Canadian outbreak shortly, because that's a big deal. That's a really big one going on right now. But yeah, even in countries that have good healthcare systems, even countries that have good education system, even countries that you typically think of as, developed, high, first world, I hate that term, countries are experiencing lots of anti-vax sentiments. It doesn't matter where in the world you are. There are people that are against vaccines. Are the rates high? Are the rates in the highest places due to political instability? There is some of that going on, absolutely. Like, for example, in Ukraine and much of sub-Saharan Africa, vaccination rates are a lot lower because of war and instability. But not just that. I mean, there's a lot of reasons why vaccine rates are low in a lot of places. Mistrust of science, mistrust of scientists, the anti-vaccine misinformation that's being spread that sounds very intriguing and convincing, especially when it's coming from people in a position of power. Affordability, yep, the cost, and lack of infrastructure. As I said earlier with the measles vaccine, it is a live virus vaccine, which means it needs to be kept cold, or else the virus will die and the vaccine will be ineffective. So getting it into very rural areas, like much of the poorer countries, like in sub-Saharan Africa, some of Southeast Asia, the Middle East, is very, very difficult. So there are a lot of reasons why vaccination rates may be low in some of these countries. But unfortunately, a lot of it, or an increasing amount of it, is due to misinformation being spread online. All right, so let's get back into this. All right, so over the past 5 years, over 100 countries had large measles outbreaks. Low vaccination rates are driving these outbreaks. 83% of children receive the first dose, with only 74% getting the second. And that's global numbers. This is obviously well below the 95% required to prevent the spread. And this sort of gets into your question. Specific drivers include the backslide from the COVID-19 pandemic, as healthcare workers were diverted to deal with that situation, a large number of children with 0 doses in fragile locations and those affected by conflict and war, weak routine vaccination systems even in countries with strong health systems, lack of access, and worst of all, vaccine misinformation. Now, let's talk about what is going on in North America. Before we do that, let's get this question from Mare. By the way, do you guys in the US and other countries have to pay for the vaccines, or is it funded by the government? So the ACIP, the vaccine, the immunization, what was it? ACIP. The people who do the vaccine recommendations in the US, when they come up with vaccines that are, when they recommend vaccines to be used, those vaccines have to be covered by healthcare, by the health insurance, which you still indirectly pay for by paying for insurance. So anything that's recommended by the CDC is covered by insurance. Anything that is not recommended by them, the person has to pay for out of pocket, which is dumb. And unfortunately, RFK Jr., I saw this recently, they are trying to get rid of all vaccine recommendations. Yay. Yay, US. We're going in wrong direction here. Waddle says that they have to pay for them. Captain Crumbs says Sweden has free vaccinations. That's fantastic. That's the way it should be. All vaccines should be available for everyone. So if people don't have insurance, they pay. Yeah. If they don't have private insurance, or they don't have, the government insurance, Medicare, Medicaid, they have to pay for the vaccines out of pocket. And some of them can be incredibly expensive. You see where the affordability comes in? Yep, absolutely. You have free vaccines as well. That's so nice. That's the way it should be. That is the way it should be. All vaccines should be available to everyone. Forget it. Not just vaccines. Healthcare should be available for everyone. End of story. Done. Everyone should have access to healthcare of all kinds, including vaccines. But unfortunately, that's not always the way it works, because stupidity. Where Big Fat Snake is, many vaccinations are free if you're over 65. Chrome says it is in Sweden. It is in several countries, which is great. Should be that way everywhere. Should be that way everywhere. Yeah. But now let's talk about the measles situation in North America. As I'm in the US, it hits a bit closer to home, and I hear about it more frequently. In October 2024, a new outbreak of measles began in New Brunswick, Canada. This gets to your question, Susan, about Canada. From there, it spread wide and fast, with all but 3 provinces or territories reporting at least 1 case. This outbreak is still ongoing over a year later. As of December 6th, there have been 5,268 measles cases associated with this outbreak. There have been an additional 148 measles cases not associated with this outbreak. Unfortunately, there have been 2 deaths from this outbreak. Both were babies that were born preterm due to the mother having measles. And guess what? Most of these cases were not vaccinated. 4,963, or 93% of these cases, had not received the measles vaccine or their vaccination status was unknown. Only 336, or 7%, had received at least one dose. So once again, the vaccine, while not 100% effective, because no vaccine is, works. It works. It is effective. If the vaccine was ineffective, then you would expect about 50% of cases to be vaccinated and 50% to be unvaccinated. While it looks like the number of new cases per week, which you can see in the picture, may be heading down to zero, it is still holding on with about 15 to 40 new cases each week for the past 3 months. Mayor, the situation with Kennedy isn't just your problem because lots of other countries, moronic leaders, are going to look at what they did and say, why don't we do it here? Yeah, absolutely. And another big issue with that is, as I've mentioned before, diseases don't care about borders. I mean, the world is very small. Travel between countries happens very rapidly these days. What happens in one country affects every other country. So, yeah, it's frustrating. It's frustrating, to say the least. In order for a country or a region to be considered measles-free or to have eliminated endemic measles, they must not have sustained transmission. They can have occasional measles cases or outbreaks, but if sustained transmission in a single outbreak lasts longer than 12 months, they lose that status. The region of the Americas was declared measles-free in 2016 after the end of an outbreak in Brazil. Unfortunately, with this outbreak in Canada, and therefore the Americas region, has lost that status. But it isn't like Canada is the only country in this region having issues. Mexico, Bolivia, Brazil, Paraguay, Belize, and the US are all having ongoing outbreaks. So now let's talk about the situation in the US and what's going on with our outbreak. As of December 16th, there have been 1,958 cases in 2025. This is the most in a year since 1992. Measles cases have been reported in 43 of the 50 states. 88% of these, or 1,713, have been associated with 49 confirmed outbreaks. By comparison, in 2024, there were only 285 cases with 69 associated with just 16 outbreaks, the remainder of which were isolated cases, mostly imported where they were exposed in other countries. As a reminder from the last video, the CDC defines an outbreak as 3 or more related cases. The biggest of these outbreaks, of these US 2025 outbreaks, began in Texas. This outbreak later spread to Utah and Arizona, becoming the first time that a measles outbreak in multiple states have been linked together. If this outbreak isn't stopped by early January, the US will lose their measles-free status as well. Of the US cases, 222, or 11%, have been hospitalized, and there have been 3 deaths. 26% of these cases were under the age of 5. And do you want to know how many of the US cases were unvaccinated? Well, you can see it in the picture. 93%. 93% were either unvaccinated or had unknown vaccination status, just like in Canada. The areas most heavily hit are the ones with low measles vaccination rates. Gaines County, Texas has an 82% vaccination coverage rate. They have had 414 cases so far, which is 21% of all the US cases in 2025. Once again, vaccines prevent disease. So that's the state of the measles in the world today. Vaccination rates are struggling and in many areas decreasing, which is causing the number of measles cases to increase. And I think this pretty well sums up how worried people need to be about measles. If you've received the vaccine, you're fine and you don't need to worry. If you or a family member haven't been vaccinated, do it. Get the vaccine. So with that, I'll stop and take any questions that you may have. Let's see. Susan says, "Dear other countries, do not model your decisions off the current administration." Yeah, I'd agree with that. I'd agree with that. She also says, "When your child dies from measles, you can't undo that vaccination decision. It's horrible." Absolutely. Absolutely. I mean, even all the negative side effects of the vaccine, even if it caused autism, which it doesn't, but even if it does, aren't those side effects, aren't those potential side effects better than the death of your child? I would think so. I would think so. So are there any questions about measles vaccination, about measles in the world today? Anything else you got for me? Anything else? Any other questions anyone's got? There's a thing called acceptable risk. Absolutely. 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 Well, seeing no other questions. Oh, wait, there's another thing. Let's see. Susan, I don't understand why you can decide if your child is vaccinated. All right, hold on. I don't understand why I can decide if my child is vaccinated, which can be fatal to my child or others, but the government can censor books that I read, which doesn't affect others. Yeah, that's a whole other issue. that is a whole other issue. Absolutely. Absolutely. That is a fair point. That is a fair point. Yeah. Yeah. As we mentioned earlier, there's a lot of stupidity out there in the world these days, and stupidity spreads very rapidly and seems to be spreading more rapidly. Can of worms opened. Yep. And if we think about the whole country, what Spock said, the needs of the many outweigh the needs of the few, or the one. Absolutely. Yes. Absolutely. Don't just get vaccinated to protect yourself. Get vaccinated to help protect others. Herd immunity works. So even if you don't care if you get the disease, even if you think that measles is a mild disease and you don't care if you get it, or you don't care if you even die from measles, which you could, think about the person down the road that has no immune system and can't get the vaccine, or if they get the disease from you, you may kill them. Think about it. Think about it. And get vaccinated. Think about it and get vaccinated. That's why I have smartphones used by stupid people. Yeah. Well, if there aren't any other questions, let's go ahead and wrap up. One measles death is too many. One measles case is too many. Measles is easy to prevent and is something that can and should be eradicated. All it takes is 2 easy shots of a very safe, very effective, and very very necessary vaccine. So please, if you or a family member do not have the measles vaccine, talk to your doctor about getting it. And please share this video or this information with anyone you know who doesn't have the vaccine. Share it with anyone who you know who questions vaccines or who is anti-vaccine, or anyone who thinks that measles isn't a big deal. If we can get 90%, 95% or more of people vaccinated, maybe, just maybe, measles can go the way of smallpox and never trouble humans again. Thank you all for joining me today. If there are any questions that I have not yet answered, please leave them in the comments. Keep your eyes out for the next stream, which will be in early 2026, where I will discuss public health in general. What is public health? Who all is part of it? And what all do we do? Though there will be a fun little bonus video coming in a few days, so look out for that. Be sure to subscribe here on YouTube, as well as follow me on Bluesky and Instagram, where I share lots of disease and public health information and news between episodes. You can find the link to those in the description. Stay healthy, stay happy, and remember, public health is for the good of everyone. I'll see you next time.